Hey guys, so welcome back. It is the end of the day for me, but I figured that I would take some time to talk to you guys about a very, very serious topic, which is treating mental illness with medication. Now, first, I must say there are many different options for treating mental illness, and according to the National Institute of Health, you guys probably will be surprised to hear this, but there are a large number of people who are impacted by mental illness in our country. Significant numbers. And I read somewhere where they say that anxiety disorders affect nearly 1/3 of the U.S. population, which means essentially nearly 1/3 of people in our country will experience anxiety disorder at some point in their life. That is a significant number, you guys. I don't know if you guys are aware of this or not, but that's why I'm here to bring awareness to this issue of mental illness, because this is very serious, you guys. And I think sometimes we don't take it as serious as it should be taken. But that's a large number of people. 1/3 of our population is said to be impacted by anxiety disorders. Now, depression, anxiety actually, according to the National Institute of Health, anxiety is actually ranked number one of all the psychiatric disorders that exist, and there are a lot of them, you guys. You guys just go check out the DSM. There are hundreds of disorders, psychiatric disorders that exist, but out of all of the disorders, anxiety ranks number one, followed by depression. Depression is also prevalent in our society, and it said that I think 3 million cases every year, 3 million reported cases of depression every year. That is a large number as well. We're talking, and that's per year. 3 million people are impacted, and that's just reported. There are a lot of people who live with these illnesses that often don't even come to the forefront. They don't talk about it. They don't share, what's going on with them. It's never reported. They never go out and seek professional help. So I want to create this video to let you guys know that there are options available, and I really want to kind of focus on psychotropic medication as a form of treatment and treating mental illness, because many of you guys are already aware. Some of you guys don't know my educational background, but I actually graduated from Florida State University back in 2006. It's very young. I was 22 years old. But however, before I graduated, my very first job in the mental health field was actually working at a psychiatric hospital with adults. It was working on a stabilization unit where adults were admitted. Most of them were admitted involuntarily, so against their own will. And on the East Coast, there are different names depending on the state which you live, that they call the act of involuntary hospitalization due to a person posing a threat to themselves or danger to themselves or others. And especially, it's mainly limited to people who have mental illness, because we know that there's another option, which is jail, that people can go to, if they pose a threat or a danger to someone else. But specifically, if it has been deemed or observed that a person, is acting, erratically due to mental illness, usually they try to place them in a psychiatric hospital so they can become stabilized. And so it was during, I think, my junior year, the end of my junior year, more like closer to my senior year, at Florida State University, where I pretty much got my feet wet in the field. I started my first job as a mental health technician working on a unit with a bunch of adults who were hospitalized. And I would say the load, if I can recall correctly, was about, I say a bunch because, it's all relative. It's compared to basically how many clients that, I've seen over the course of my career. But I would say it was about 50 to 60 The hospital was kind of like a smaller hospital. It wasn't like a big hospital. It was more like a smaller size hospital. The unit where I worked, it was about 60 patients, and they were adults, and I wouldn't say that it was an eye opener. I don't know, because I think just being considering my social context in which I grew up in, like I've been exposed to people who suffer from mental illness, but working there, definitely I feel like I learned a lot. Like I said, it's not really an eye opener, but it did. Um, I was exposed to a variety of different cases of adults, with mental illness, from people who were there because they posed a danger or a threat to themselves. They were a suicidal risk. There was a kid who's actually a college student, was there, who had attempted suicide, was unsuccessful at it. He attempted to hang himself. Because he was going through a lot, and it's a lot of things that can trigger a person to commit or attempt suicide. One of the biggest factors within depression is hopelessness that people experience, that is said to be one of the biggest predictors of suicidal ideation or suicide itself amongst people, who suffer from depression. And so I do remember there was one case where this kid, he was a college student. He had been going through a lot, had a lot of stress, and he had attempted suicide. And, he got Baker acted. On the East Coast, they call it Baker Act. Like I said in the beginning, there are different names that they assign to the involuntary hospitalization of a person who poses a danger to themselves, an immediate danger to themselves. On the East Coast, I know in Florida it's called Baker Act. Out here in California, they call it 5150. But different states have different terms that they call it. And, it's unfortunate. It's a very unfortunate situation. But it's there to protect people. It's there to protect people's safety and well-being and their health ultimately. So, I know a lot of times people are opposed to the involuntary hospitalization of people, but it's something that has to take place. And, that was one of my first jobs in this career. And I was really young. I was probably like 20, 21 years old when I worked there at the hospital. But many of the patients there, they not only suffered from suicidal ideation, or harm to themselves, but a lot of them actually, had severe psychiatric illnesses such as schizophrenia and delusions, bipolar, depression. It was pretty severe cases. And that was my first job. After I graduated, immediately after actually before I got my degree, I actually got offered a full-time position, working as a residential counselor in Jacksonville, Florida, my home city. So that was like my second job. I guess you can say more of a face-to-face job, because I've worked many different jobs in this field of mental health. So following my job as a mental health technician at the psychiatric hospital, I actually worked as a crisis counselor for 211, working on a suicide prevention hotline, taking calls. I did that through my senior year up until graduation. And before I actually graduated and finished my studies, I actually was offered a full-time position working as a residential counselor in a residential facility for youth, primarily African-American youth, who were basically wards of the state of Florida. So they didn't have a permanent home. They were considered, foster care kids. But it was a part of a statewide inpatient psychiatric program that I was working under. And on the unit where I worked, it was I would say about 5 to 6 clients, male boys that were there. And, they were there because they didn't, they were abandoned. Many of them were abandoned as children. One case, a kid, was found in a dumpster. Unfortunately, his mom left him there when he was very young, and so he just pretty much grew up in foster care. As a lot of those kids do, they go from one placement to another placement to another placement to another, And the place where I worked was kind of like the last straw for them, like they didn't have anywhere to go. So the place where I worked in Jacksonville, Florida, when I was very young, like 20, I was 22 when I graduated with my bachelor's degree from Florida State University. So this was like, I was like 22, 23 years old when I first started working um, at the residential facility as a residential counselor. And it was about, like I say, about 5 to 6 boys there. And many of them, suffer from severe psychiatric disorders. And the thing about mental illness is that it can evolve from many different stressors. It can be biological, something hereditary, and it can be environmental causes that, impact an individual's mental health and eventually evolve into a psychiatric disorder. So all of them basically were diagnosed, had severe psychiatric disorders, including schizophrenia, bipolar, depression. They were struggling with some things. And the treatment approach that the facility where I worked was pretty much more of a multidisciplinary approach. So we had a psychiatrist, we had psychologists, we had therapists, we had residential counselors. As my role, I worked directly with the youth and, pretty much acting as a caregiver. Not only that, but we also administer medication, which is a really important piece that I'm going to talk about. The medication was a really, really important piece as part of their treatment plan. There were certain things that they worked on with the therapist, to deal with certain psychological issues they were facing, emotional issues, behavioral problems that they exhibited, because many of the boys were considered to be out of control. It was a lockdown facility, so, it was pretty secure. They couldn't go and come as they wanted to. These were boys between the ages of 5 and 17 years old. They could not go and come. They were locked down, and they were court-ordered and mandated by the judge to be there. They were wards of the state of Florida. And because of the etiology and the prognosis of their mental illness, because it got to the point where, it's unfortunate that this happens, but a lot of times what you see in mental health is that a person's mental illness can get progressively worse, so to the point where it's like they look at medication as the only option to treat the person. That's the only way to effectively manage the person's, psychosis or psychological symptoms, psychiatric symptoms and behaviors. And those boys, like I say, did exhibit some behavioral problems. Sometimes they would try to break out, sometimes successfully, where they would actually somehow find a way to, weaken the locks on the doors and kick right through it. It's like, it was amazing because it was a really enforced structure where I work, but we're talking about kids who, have been through a lot, have endured a lot, and it makes them strong. And the medication, I think, makes them very resilient. They're young little boys, babies, but they're strong, So they were able to kick through and break out sometimes, and we had to make a report, and it just got really crazy. And so for the most part, a lot of times the intervention that was used was medication to manage the behaviors. And the ones who were diagnosed with psychotic disorders, typically they give them antipsychotic medication, including Abilify, Seroquel, Risperdal, and it's basically sedates them. When we had cases where the boys would become physically aggressive or a dangerous threat to themselves or, staff or other clients, we would have to physically restrain them. Like, this was actually part of my job, So I am pretty well trained in CPI. It's crisis prevention intervention. Basically, it's supposed to be a least restrictive way of intervening, a very safe way. It's supposed to be hands off, so they teach us different de-escalation techniques to resolve conflict without having to put hands on. But if it comes to the point we have to put hands on, then we intervene, and there's a certain way that we're trained to restrain an individual. And being that I was very young, I was really, really, really young. I was like I said, 22, 23, 24. I was young. And being a female, I felt it kind of difficult. That was like one of the biggest challenges that I even expressed back then that I faced having to do that part of my job, to do the physical restraints. And I was not only that, but I was the only female who worked there. The other staff were men, and they didn't have a problem, intervening physically and restraining the boys and stuff. And what would happen, because it was an interdisciplinary approach, that involved many different people from many different professions, including nurses, when we administer the physical restraint, if the client wasn't able to calm down, and control their behavior, which was 90% of the time, they just could not. The restraint actually would trigger, a reaction in them that made them kind of fight. It was like a fight or flight type of response, and they would always fight. It would actually escalate, I think, the situation. That's the reason why I really was opposed to doing the restraints, because it made it worse having to restrain them. I took a different approach, wanted to be more emotionally supportive, and really tried to find ways to prevent a situation like that from occurring. So I was very humanistic in my approach in relating to the boys, more like a mother type of approach. And because I just didn't like to see the restraints. It was just crazy. They would fight and kick and scream, and because some of them suffer from paranoid schizophrenia, it does not help to put your hands on a person who's paranoid schizophrenic. Like, it only makes it worse. And so the men staff, were restraining, and there was one kid, he was just like, "Stop, you're trying to kill me," fighting back and just going crazy. And would come the nurse, who would administer a shot of Ativan, which is basically an anti-anxiety medication, and they would administer it intramuscular. So they would put it in, the client's butt. It's a shot that they would give them in their butt, and it is done intramuscular. They insert it into their muscle, right straight to the muscle, and it goes throughout their body. And it basically is a calming mechanism. It relaxes their body, it relaxes their mind. Eventually they will go to sleep, And so I say that to say that it makes me wonder that, given the frequency of the restraints and how many times a nurse would have to administer this PRN shot, of Ativan, it almost made it seem as though they were acting out on purpose to get the shot, because we know that anti-anxiety medication can be very addictive, and Ativan is an anxiolytic. I always have difficulty pronouncing these terms, these medical terms, but it's an anxiolytic, and it's used to counteract anxiety. And it's a relaxing medication. And so it would circulate throughout their body, and they would be calm, and then eventually they would just go down to their room and lay down and go to sleep. Right? And like I said, it makes me wonder, would they act out on purpose? It seems as though they knew that, okay, if I act out, I would be able to get this shot, and the shot makes me feel good, so to speak. So we had a high frequency of them doing things to act out, and which would result in a physical restraint, that the male staff would come in and physically restrain them, and then we would have to call the nurse, and she would come in and shoot them right in the butt, and like magic, within minutes, they relaxed, right? And I feel like that, to me, it got overwhelming at a point, just to have to experience that. My work schedule was crazy, working 10 hours a day, 4 days a week, full time, but 10 hours a day of that, it did at one point become overwhelming eventually. And I ended up resigning. I ended up having to take a break for my own self-care and my own health, because being exposed to that kind of trauma, because in a way you can look at it like it's traumatic to see a person going through those things. And not only that, not just the restraints, but the behaviors that some of those clients would exhibit. I mean, the head banging. We had clients that would cope with stress and anxiety by banging their head so hard to the point where it's just blood dripping. These are little baby boys, you guys, little baby boys. It's so unfortunate. But, that was the case, and that's what happened. And like I said, I ended up, having to take a break I did take a break for a little while after that. But I came back to the field. It's like I always was attached to the field of psychology and mental health. It's always been in me, because ever since I took my intro to psych class as a freshman in college, I was like 18, 19 years old. I grew an affinity towards psychology, and the helping profession. And not only that, but I think it kind of runs in my family, because my mom, she's worked her entire life. She's worked in medicine, in hospitals. So kind of that gene, I guess, kind of got passed down to me. And although her focus was medical, mine is more psychiatric or psychological. So still kind of the same. And it's funny because I remember her asking me when I was a student at Florida State, she's like, why do you want to become a psychologist? This was way back then when I was at Florida State. Like I said, I graduated class in 2006 at the age of 22. And she would ask, she's like, why do you want to become a psychologist? It's like, Mom, it's not much different than what you've been doing. You work with people all your life, in the way of medicine and helping people. So for me, I'm looking at something a little bit different. It's still health. It still falls under the umbrella of health industry, the health field. But she could never understand why. And I just say, well, I don't know. It's just something that grabbed me, about psychology. And I've been with it ever since. And so following my hiatus from mental health, actually during my hiatus, the mental health field, I actually, that's when I began to write. I began to journal, and I got into publishing books, and I became an entrepreneur, and I've always had it in me to still give back to the Black community, still give back to the community at large, not just the Black community, although I have developed certain programs targeted towards the African American community. Following my hiatus, I moved to New York City to finish my master's degree. I started my master's degree actually in Florida, following my bachelor's degree. So right after my bachelor's, I went into a master's degree program in Florida, and I finished my master's degree in New York City. And while working towards my master's degree in New York City, I did work in an outpatient facility. It was more of a higher function. And so although, they were court ordered to go to therapy because of substance abuse or domestic violence related issues, many of them were higher functioning and many of them were not on medication. However, currently now I do work with a group of adults who are, most of them, over 90% of them are on medication. I have a caseload of nearly 30 clients, adults with intellectual and developmental disabilities and severe mental illness, and majority of them are on medication. I mean, medication really is a very common treatment option that is prescribed by doctors, in our field. It's just something that they use to manage and regulate these symptoms that clients experience, And I know some people may say, oh, well, they're opposed to medication because they don't like the side effects of it. That's a whole nother issue, right? Because let's take, for example, depression. As I said, depression is a very prevalent psychiatric disorder in America. A lot of people are impacted by depression. They can become depressed for many different reasons, and it's not necessarily a person's fault that they are depressed. Like it's an innocent disease, I would say. And it's funny because now that I say that, I'm thinking about my professor at Florida State. He would always say the opposite of depression is participation. So in one vein, I guess you can say that a person, is partly responsible for their mental illness or their depression, because of their behavior. You know, if you isolate yourself, that kind of contributes to more depression. It makes you feel more depressed when people isolate. And people tend to usually isolate, you know, because they feel bad. Something is going on in their life where they just want to be alone. That's their way of coping. But in choosing that form of coping mechanism, you know, it affects their brain. You know, it's amazing how our social interactions can affect our health, essentially. So lack thereof of social interaction can have an impact on one's mental health, on the brain. You know, we think about the brain, you know, and brain chemistry, you know, it has to have a homeostasis. It has to have a certain level of chemistry within the brain with respect to the neurotransmitters that are in the brain, the different chemicals that are in the brain. It has to be at a certain balanced state, and when it gets imbalanced, and that's where problems occur. So with depression, the underlining component of depression is a deficiency in serotonin, which is a neurotransmitter in the brain. And so that's the reason why psychiatrists, and that's their role, where they come in, is that they have, you know, through these pharmaceutical companies, have created these drugs that act on the neurotransmitters into the brain to regulate this imbalance, you know, of serotonin in the case of depression. As far as anxiety, there's the GABA neurotransmitter, which stands for, let me see, can I remember? The gamma amino. Okay, I had it in my memory, you guys, but it just, gamma amino. Forgive me for forgetting, but I just call it the GABA neurotransmitter. But that's basically the neurotransmitter that's related to anxiety. You know, so they have medication that acts on the GABA neurotransmitter in the brain to basically relax the body, relax the mind and the body. You know, and unfortunately, with anxiolytics, which is anti-anxiety medication, they are highly addictive because the effects of anxiolytics take place immediately. Okay, I think it just, I was just trying to remember. I almost got it, you guys. Gamma amino. Is it butyric acid? Excuse me, guys. I'll post it below. I'll comment below. It's slipping my memory. So much terminology. It's like so many terms floating around in my head. But that's why there's abbreviations, you know, and acronyms. So just call it GABA for short. But it's a neurotransmitter that's related to anxiety. And with respect to bipolar, usually lithium is prescribed. And there were a lot of kids, as I was talking about earlier, when I worked as a residential counselor with the kids who were wards of the state of Florida, there were quite a bit of them who were diagnosed with bipolar, and they used lithium to regulate those neurotransmitters that are associated with an imbalance. It's basically a mood disorder. You know, bipolar is a mood disorder, so the lithium is able to regulate a person's mood. But however, lithium is a pretty dangerous substance. You know, although it's found in food and water, you know, it's in smaller amounts. When we're talking about medication, it's in much higher amounts. You know, it's also actually found in batteries, you guys. You know, I'm pretty sure you heard of the word lithium, but it's used to treat mental illness. You know, and the side effects can be very debilitating. You know, the side effects of a lot of psychotropic medication can lead to a lot of things that people don't want, like tic disorder, involuntary movements, muscle spasms, you know, even increased thoughts of suicide. Like, you guys heard all the side effects when you guys watch these commercials, and at the end of the psychiatric medication commercials, you hear them talking really fast. These are the side effects, you know, so there's a lot of side effects. Speaking of antidepressants, including Paxil. Paxil is one of the most prescribed antidepressants. It's pretty common. the one of the side effects that you hear a lot of patients complain about with that is that they feel these out of body experiences. And it's like, okay, do you want to be depressed, you know, or do you want to feel these out of body dissociating experiences where you don't even feel in touch with reality, you know? That is a whole nother issue, you know? So it's like, yes, we have these psychotropic medications available to treat mental illness, and sometimes it's needed because we have people who can't regulate themselves. They can't regulate, you know, their thoughts, their emotions, their behaviors. So that's where medication comes in to help regulate those emotions. And by the way, psychotropic medication, I should have said this earlier, but it's basically these substances are created by scientists that alter a person's brain chemistry, which can affect a person's cognitions, their behaviors, their consciousness, their emotions, pretty much everything. It can affect everything, but it is targeted towards a person's psychological well-being, you know, their neurology in the brain. So I always warn people to take caution when it comes to deciding to take these psychiatric medications or psychotropic medications, because although, yes, it could, you know, regulate what's offset in the brain, it still has side effects. And a lot of times the person gets progressively worse. Like I've worked in these hospitals where it's very unfortunate, you know, you see it firsthand what happens to people who are on these psychotropic medications for an extended period of time. You know, it's like they become vegetables. Especially just looking at the little kids I work with, you know, these boys, it's like they were on medication ever since they started prescribing it young. I'm talking about 5-year-olds taking antipsychotic medication, and for an extended period of time, you know, it's like they become vegetables. They walk around like zombies, literally, you know, drooling. They can't even control their mouth movements, you know. They have this looseness of their muscles in their mouth where it's hard for them to be able to control the drooling, you know. It's just unfortunate, you know. But like I said, one has to weigh the costs and the benefits, you know. As a doctoral student in training, you know, a clinical psychologist or clinical psychology student in training to become a clinical psychologist, you know, I'm only here to educate, but I want to encourage you guys, you know, to seek professional help from a licensed professional, you know, if you experience anxiety, depression. A lot of you guys already have, you know. Medication is just one option, but there's therapy, you know. And it's funny because I'm actually in therapy, you know, not necessarily that there's something wrong with me per se, but it's required of all PhD students in clinical psychology in my program to seek therapy, you know. And across most PhD programs, they just highly recommend, and it's part of the career. It's like part of the requirement, you know. We can't even get our PhD unless we do a certain number of hours of therapy, you know. And I think it's a good thing, because outside of that, a lot of people don't even go to therapy, you know. I've been to therapy outside of this because I recognize the benefits of it, you know. Being able to talk to someone, being able to process these things that you experience and you go through, it's like a luxury, you know. And I feel like that's the first step, just going to see a licensed therapist, a licensed mental health professional, a licensed psychologist. Psychologists have a little bit more training than therapists, you know, and the psychologists are actually trained to do assessments, whereas therapists aren't. That's their limitation. So psychologists can be able to take a more objective view and conceptualization of a person's problem, because they use certain tools and measures to be able to understand what's going on with the person. There are many different neurological tests that can be done, neuropsychological tests that can be done to determine what is going on within a person, you know. So I would recommend you guys to, you know, if you're seeking professional mental health help, I would recommend to see a licensed psychologist, you know. But there are therapists out there who also are good at what they do, you know. Either way, you know, I feel like it's being that the help is there, it's out there, you know, and insurance covers mental health counseling. It's like, why not why not take advantage of it, you know? And then the whole idea about should you take medication? Well, that's something that your psychologist would determine. You know, psychologists will make a recommendation for you to see a psychiatrist, and they'll do an evaluation to see if it's, you know, if it's beneficial for you or not. You know, and also psychiatrists are trained in medicine, so they're able to assess how medications interact with each other. So they will be able to say, okay, well, this medication, you know, we recommend this psychiatric medication based on the medications that you may already be taking for a certain medical condition. You know, that's why it's important to seek professional help by a licensed, well-trained psychologist or psychiatrist. You know, psychiatrists really don't do therapy. Many of them don't. They just meet, they do a quick evaluation, and then they write a prescription. You know, it's very quick with when going to see a psychiatrist, but a psychologist will take the step to do, you know, an evaluation, to do testing, and to do therapy. You know, but I think that's pretty much all I have to say with regard to this topic, you know, at least for now anyway. I may come back and do a part 2, but I just wanted to bring that to you guys' attention because so many people are out there suffering, you know, suffering and pain, and they don't know where to turn. A lot of people go to church, which is good because you get a lot of support, emotional support from people that you trust at your church or different organizations in the community, you know, but it's nothing like that one-on-one therapy. I just came from seeing my therapist today, and you know, I always feel good when I go to therapy, just being able to talk to someone in a confidential setting, knowing that what I share with this person is going to be held in confidence. It's only going to be between me and the other person. It's beautiful to be able to go do that. Beautiful. And why I'm still stuck why am I still stuck on the GABA, y'all? Why am I still stuck on it? It makes me want to look it up. Hold on, you guys. Okay, there we go. It's gamma aminobutyric acid. See, how hard is that to pronounce, right? It's like the more you say it, the more you commit it to memory. It was already in my memory, but it just evaded my memory when I needed to use the word miraculously. But yeah, that's pretty much all I have to say. I have to get ready to head home. You know, I'm actually out here at UCLA. I gotta head home. I'm tired. It's the end of the day for me, and I'm just happy to see that I feel like more and more people are learning about mental health. You know, yes, there's a stigma surrounding it. You know, people are ashamed to open up, but it's just, I feel like this is just being human. That's why, hey, that's why for me, it's like I feel like it's important for me to be a role model in mental health, you know, to show that it's okay to cry, you know, not necessarily all the time about every single thing, you know, but if something bothers you, you know, if you're hurt, it's good to get it out, to express yourself. Crying is just an emotion, you know. People are like, oh, you know, you shouldn't cry, you got to be tough. There's this thing in the Black community, it's like people laugh at people who cry, you know, especially men. Don't let a man start to break down and cry. You know, everybody in the Black community, he's going to get roasted, you know. But I think it's a little bit easier for Black women, but sometimes not still, because we still get thrown on the bus, you know. You drop one tear, you know, people just thinking that, okay, you're an alien or something is wrong with you because you're crying. And it's like, big deal, you know, you're crying. People cry for different reasons, you know. They may be emotionally in pain. They may be in fear, you know. It could be many different things that drive a person to cry. They may feel powerless, you know. A lot of times when I cry, that's what it is. Like, I feel powerless. I feel like I can't do anything. What can I do, you know? Especially if I'm being attacked, you know. And I feel like there's nothing I can do, then I cry. But there's always something that you can do. And I'm glad that I actually met with my therapist today. And I was able to kind of decompress and share some things that I was going through. And you know, it's okay. It's like you recognize that there's something wrong, you reach out to get help, you know, and then you feel better, you know. So there's nothing wrong with that. There's so many resources out there available for us, you know, as people, and I think that it's only appropriate to take advantage of those resources that are out there. And if you don't know something, ask questions. Don't hesitate to ask questions, you know. But before I end, I actually wanted to end saying that I am in the process of developing an app, a mental health app. That's all I'm going to say. All right, catch you guys later. Love you guys. Thank you guys for watching. Share this video. Bye bye.